Hello. By now, you must be at the comfort of your home. Now, proper home care is an important part of your overall recovery and healing. So I would like to take a few minutes to review with you the instructions that we provided at our office. Inside your gift bag, you will find everything you'll need for your home care. These include a complete post-operative instruction sheet, reusable ice packs, an ice pack holder, packets of gauze, your medications if they were provided at our office, or prescriptions to be filled at your pharmacy, dietary recommendations and recipes, as well as a reminder card all about the important oral rinsing. The instruction sheet contains all of the information relevant to your home care. On the first page, you will find the highlights and the key instructions. Below it is a list of items that you should not be concerned about, and then a list of items to look out for and call us immediately if noted. The instruction details are described in the following pages. So let's go ahead and take a closer look. To control bleeding, simply roll up a gauze from your packet and place it over the surgical site and bite down on it very firmly. Replace the gauze every 30 to 45 minutes until the bleeding has completely stopped, as noted by the lack of red or pink color on the gauze when changed. Avoid forceful spitting and do not use a straw for the first 24 hours, as they both can disturb the blood clot. Also, make sure to rest and avoid any strenuous activities for the first 24 to 48 hours. If slight amount of bleeding continues until the next day, it's absolutely okay, but continue with the gauze and the firm pressure until it completely stops. Do not rinse or brush tonight, but starting tomorrow, you may begin the oral rinses with salt water or regular water every 2 hours and continue it for at least 2 weeks to help prevent infection and also promote healing. Rinse more gently for the first or second day, but then you can do it more vigorously thereafter. Make sure to rinse hard enough to wash away any plaque or debris that may accumulate in the surgical site. To make the salt water, simply add about half a teaspoon to a glass of water or about 1.5 teaspoons to a water bottle and stir. Do not use any mouthwashes containing alcohol that may irritate the tissues. You may continue with brushing and flossing your other teeth regularly, but avoid the area near the surgical site. After 10 to 14 days of healing, you may gradually return to normal brushing and flossing as you feel more comfortable. You may have been advised about potential swelling in your particular case. If so, place the ice packs that were provided in your packet in the pockets of the ice pack holder, and then wrap it around your face and secure it with the Velcro on the top of your head. These ice packs are reusable, so place them in the freezer for about 30 minutes and replace back on the face. If the surgical site was in front of your face, then use the ice pack directly without the holder. Continue using the ice pack for 24 hours when it's most effective. Ice does not provide much benefit after 24 hours, but it's okay to use it if it makes you feel more comfortable. Remember that swelling maximizes in about 48 hours after surgery and then gradually diminishes over the next 10 to 14 days. So don't be alarmed with the increased swelling in the first or second day. It's absolutely normal and okay. Do not smoke for at least 7 to 10 days in order to avoid the immediate post-operative complications that include bleeding, dry socket, infections, and poor healing. And it's recommended to cease smoking altogether for 6 to 8 weeks following your surgery in order to promote the healing process. But it's important to note that smoking altogether is a significant risk factor for oral health and also the longevity of your teeth and dental implants. Therefore, a complete cessation is still the best long-term recommendation. Keep a very gentle diet limited to mostly soft foods and liquids. This should be continued for about 5 to 7 days for post-extractions, about 10 to 14 days for dental implants and soft tissue procedures, and about 2 to 3 weeks for bone grafting procedures. Foods like soups, mashed potato, yogurt, soft eggs, and soft rice are generally safe. You may also have protein or fruit shakes or blenderize just about anything into a smoothie. Check out some of our recipes in your packet. If you have had a major bone graft procedure, avoid dairy products for the first 3 days after surgery and keep your diet limited to clear liquids. Also in your packet, you may find your medications, including antibiotics, pain medication, or both, if provided at our office. Otherwise, you were given regular prescriptions, which can be filled at your pharmacy or electronically sent to your pharmacy and ready for pickup. Please follow the recommended dosage and the intervals exactly as written. For pain management, there are several strategies as described in the instructions in your packet. For non-narcotic approach, take 3 Advils, which are 200 milligrams each, plus an extra strength Tylenol, all at the same time. This combination, when taken together, provides adequate pain relief for most patients. However, you may take Tylenol number 3, which has codeine, or Vicodin containing hydrocodone if you choose to do so. Both of these medications do require a prescription. Please make sure to read the specific instruction on pain management in your packet for details. If you take other medications, you may now resume those normally. Post-operative nausea or vomiting can happen either from IV sedation anesthesia or narcotic pain medications. For relief, take 1 ounce of carbonated water every hour for about 4 to 5 hours, or 2 to 3 teaspoons of Coca-Cola syrup every 4 to 6 hours. And you can follow this with a mild tea or clear soup. If nausea persists, and anti-nausea medications may be prescribed. Night guards or retainers may be used 24 hours after the procedure as long as it does not impinge on the gum tissue where the surgery was performed. In some circumstances, your transitional or temporary teeth may require adjustments before placing it in. Please follow the specific instructions that were given to you at our office. If you have other dental treatments planned, you may also proceed with those quite safely in about 2 to 3 weeks. If you have had IV sedation, you will feel tired and drowsy for about 24 hours. It is best to rest and get assistance from family or friends during this period. Traveling or flying after surgery is absolutely safe, but certainly a good idea to rest for a day or 2. If you experience any of the following signs or symptoms, please call us immediately. Any pain that seems to increase 3 to 5 days after surgery. Any swelling that seems to increase 3 to 5 days after your procedure with increase in pain or drainage. Any significant bleeding that continues more than 8 hours after the surgery. Any drainage or infection which is marked by swelling and increase in pain. Any rashes, hives, or itching that may indicate allergy or sensitivity to medications. Or significant opening of the incision areas over grafted regions. Again, remember that the most important instructions following your surgery are frequent oral rinsing with salt water or water for at least 10 to 14 days, gentle diet, and taking your medications as instructed. During the next 2 weeks, you will receive a series of emails with important updates on what to expect and what to do. So please read those emails or forward them to the individual patient. If you have any further questions, please visit facialart.com/support for expanded information on all aspects of your post-operative care. And if you need to contact us after hours or on weekends, please call our office at 301-654-7070 and follow the instructions for an emergency callback. Make sure to leave your name and number, and I will personally call you back within a few minutes. Thank you again, and we all wish you a very quick recovery.